Hi, I'm Dr. Samir Patel at the Neuromedical Center. If you're having back pain radiating into your hip and groin, you may have a condition called SI joint dysfunction. SI joint dysfunction is characterized by low back pain, often radiating into the buttocks or the groin and down to the knee, but typically not past the knee. It is differentiated from sciatica as opposed to there is no numbness or tingling down to the foot. So people get SI joint dysfunction for a variety of reasons. Number one, it could be trauma. Number two, arthritis, which is related to aging and degeneration of the spine. Number three, it could be pregnancy. It's a common cause to have back and butt pain in pregnant women. And number four, last but not least, SI joint dysfunction be caused by the way you walk, especially the way you walk when you have back pain. You can diagnose SI joint dysfunction by seeing your doctor with a history and physical exam, and he can use different modalities such as X-ray, CAT scan, or MRI to help confirm the diagnosis. If you're pregnant, however, some of these imaging modalities may not be applicable to you. However, physical therapy and Tylenol may best treat your SI joint dysfunction. So if we suspect SI joint dysfunction, one of the first tests we're going to get is an MRI of the lumbar spine. This will help differentiate whether the pain is coming from the SI joint or if it's coming from the disc or a nerve root problem causing sciatica. Different ways to treat SI joint dysfunction are many. Conservative approaches to treating SI joint dysfunction is number one, medication management, including Tylenol, Advil. Number two, physical therapy. Number three, steroid injections in the SI joint. When you start having back pain and you treat it with rest, ice, medication, and it's not getting better, then you may seek a consultation with your primary care doctor.